What's going on, everyone? Today in this video, we want to talk about masking. You know, the thing that's on my face, these things, N95 masks. Because this is something that is really starting to make people very, very upset. Masking is becoming optional or even completely ending in healthcare. Let's read this article from WBUR. Masks will become optional for most hospital patients, visitors, and staff. And this is in relation to Massachusetts. It's not just happening in Massachusetts. It's happening all across the country. But as of last night or last couple days, there is a movement that's going on now to have, petition this to keep masks in healthcare settings. People are really upset, and there's been a big movement on Twitter with people posting several different things, some very, very upset about it, and rightfully so. Let's take a little bit deeper into this. Let's take a look at hospital-acquired infections. Look at this. So this is from Michael Olson. He says, he started working on getting a template set up for adding XBB.1.16 to U.S. states. He was working with his CA file as a starting point, and something really jumped out at him related to healthcare associated, a healthcare acquired infection. Look at this. Look at this red line here. Here you have healthcare hospital acquired COVID. Look what's been happening this year as we have seen masking relaxed, less people masking, less people boosted, any number of situations. Look what's going on here. It is going straight up. Hospital-acquired infections are going straight up right now. And we go back to this other article. Masks are going to become optional. So now's a good time for masking to become optional in hospitals when hospital-acquired infections are hitting all-time pandemic highs. Does that make any bit of sense to you? It sure as heck makes no sense to me. And then you got the World Health Organization. These bunch of clowns here. I'm sorry, that's how I'm going to say it. They are celebrating, oh, pandemic's over. Is it? The emergency's over, but is it really over? Look at hospital-acquired infection. So, say someone needs to go in for a hip transplant or something, or a hip replacement, I should say. Or maybe they do need a heart transplant. Maybe they have to go in for triple bypass surgery. Any kind of surgical procedure. It is clearly not safe to do that right now. Look at this. Hospital-acquired infections going straight up. So the odds are right now, if you have to go to the hospital for a procedure, there is a strong chance at the moment you could catch COVID while in the hospital. And we all know many people who end up in the hospital for whatever reason are high-risk, vulnerable people. So now we're risk giving them COVID. And if you saw the numbers this week, I'd have to go back to BNO, don't have it up right now, but if you saw, deaths went ever so slightly higher this week. Could that be from hospital-acquired COVID affecting high-risk immunocompromised people? It's very well possible. And here's the other deal. Look how these numbers are rising. They've been going up since the start of 2022. Funny. No, it's not funny. Very peculiar. Mysterious. That's the word I'm looking for. Very mysterious that right as these numbers are going up, guess what they want to stop doing in the United States? Can anyone take a guess? They want to stop testing people who are entering the hospital for COVID. That's right. If you're entering or going into the hospital, good chance, it's not going to, every health facility is going to be different, but a lot of health systems or hospitals are not going to test you for COVID anymore. I mean, why would they? The number's going up. Oh, we got to get that number down. We got to get that number down. Well, one way to do that, stop testing. If you don't test for it, you don't catch all the cases. And that's clearly what they want to do. But at the moment, this is, again, it's rapidly going up. It's really, really concerning. And the next question becomes, are they counting all the hospitalizations that are being catched in the hospital as an active COVID infection? Because remember, we have the, is it with, or is it because of COVID, and all that nonsense? Remember that nonsense? And some states, I'm assuming, if you're already in the hospital for something else and you test positive, they're probably not even counting that as COVID. Because if it's rising this much, and we were counting all the cases on the hospitalization, total number of hospitalizations, I guarantee you the total number of hospitalizations in the United States would be a much higher number. And we have multiple people we can thank for this lovely mess. The people here at the WHO and at the CDC for just really leading us in the wrong direction. The WHO is a major disappointment. Just about a week ago, some people at the WHO said XBB 116 is really concerning. Well, if it's that concerning, why did you end the pandemic health emergency? Why? There was no reason to. Hospital-acquired infections, again, are at the highest level ever. You're supposed to go to the hospital to get better. You know, get better from whatever your illness is. For whatever reason you went to the hospital. You're not supposed to go there to catch the most transmissible airborne virus ever known to man. Or at least in our time. I mean, that's just not supposed to happen. It's not supposed to work like that. So, yeah, that's what I want to talk about. It's just, masking needs to stay in healthcare. And it's not just even all about hospitals. If someone's going to a doctor's appointment, right, and they're high risk, they should be allowed to ask the person who's providing care to them, look, can you please put on this N95 mask? I'm high risk. I really want to stay protected. It shouldn't be something that has to get argued about. It shouldn't be something that says, well, we can't really do that. The pandemic's over now. You're not allowed to ask. This is something I saw yesterday. I think it's in Massachusetts. They were saying, you're not allowed to ask the doctor or nurse to put a mask on. That goes against our policy. It goes against the policy of keeping a patient safe and healthy. That's a bunch of bullcrap. I mean, sorry for being so upset here, but it's really frustrating to think that we have come to this point in the ballgame. I mean, who would have ever thought that we would get this lazy and incompetent, or whatever you want to call it, just so laid back that we don't even care about keeping high-risk people safe. It's just completely, utterly ridiculous. So please, if you are someone who is a doctor, you have a healthcare facility, you have a medical practice, maybe this is getting to someone who's the CEO of a medical facility, of a hospital system, please, for the safety of your patients, for the safety of the general public, for the safety of your staff, bring back masking in healthcare. I got a news flash for you. Temple Healthcare here in Philadelphia sent me an email last night through the Philadelphia Phillies. I get emails from them because pre-pandemic I would go to a baseball game sometimes. Not safe to do that anymore. No one mask at baseball games. They were advertising, sign up to become a nurse at Temple Health. $7,500 to $20,000 sign-on bonus. They're that desperate for nurses because nurses and doctors are completely burnt out. Some of them have long COVID. And now you think's the time to end masking? No, now is not the time to end masking. Guess what? The remaining staff you do have will get sick with COVID or any other virus. There's a lot of other viruses out there. And guess what? They're going to get long COVID, and you're going to be even more short-staffed. And guess what's going to happen? You're going to have to divert your hospitals, and the general public's going to have to go more miles out of their way just to get the treatment they need. If someone's in cardiac arrest, every second it takes to get to the hospital is critical to saving their life. And guess what? Some people are going to lose their life all over wearing a simple N95 or better mask. That is all I wanted to say. I'll see you all again next time. If you want to see more content on my channel, or you like this, give it a thumbs up, or hit the subscribe button down below. Have a great night, everyone. Stay safe. I will see you all again tomorrow.